Blood centers in some U.S. cities are now down to just a one-day supply, and some hospitals have even been forced to postpone surgeries. Joining us right now to discuss more is Dr. Scott Conard, author and clinical researcher. Dr. Conard, thank you so much for making some time for us this evening. First, what has caused this nationwide blood shortage?
Well, it's really two things coming together. As we know, we're in the middle of a COVID epidemic, or pandemic, I should say. And people have been very reticent to get out and donate blood, to go to the blood banks, and so the donations have gone down significantly. But as things have opened up, people have put off elective surgeries or things that they needed to have done, but it wasn't emergency for a very long time now. It's been well over a year, and so they're having to go get those surgeries and things. As a result, the need is going up. And finally, the really interesting thing that I don't think any of us anticipated is that trauma. Gunshot wounds are up 10%, and as a result, there's a lot more blood that's needed to take care of that, car accidents and gunshots. So all of it's coming together to lead to this crisis in blood supply.
And to that point, Dr. Conard, let's talk about, those postponing surgeries. How critical is it maybe when a surgery is canceled for a patient? Could this impact their health in the long term?
Well, there are a lot of people who don't get to have, it's not just elective surgeries, it's not just, eyebrows and neck, tummy tuck, stuff like that. We're not talking about that at all. We're talking about people who have needed a liver transplant and have been waiting to get it, hoping that things will get easier and they'll be able to have more of a blood supply. People who've had elective heart surgery that are, having chest pain that really want to have their surgery and have been waiting and waiting, as well as some larger other surgeries, whether that's, and there's just a whole list of them. So I won't bore you with the list of the surgeries, but everything that wasn't an emergency basically was put off. And now as things were getting a little bit better, those things have reached a critical level that they need to get taken care of.
Dr. Conard, other than those surgeries, what else are these blood donations used for?
Well, I think that many of us don't realize that when people get sick with infectious diseases and we become what they call septic, we often need blood transfusions. Cancer patients all the time need blood transfusions because the medicine we give them drives their blood cell counts down because it suppresses their bone marrow or the blood making cells. And so it's a part of medical care for many, many different conditions, not just surgeries.
And here we are, obviously, amid this pandemic. I got to get your take. Does being vaccinated against COVID-19, does that affect your blood donation at all?
No, not at all. You don't get weaker when you give your blood donation. It doesn't change your ability to fight off COVID. In fact, I doubt you'll be giving enough antibodies to protect somebody, but who knows? Maybe you're going to give a couple antibodies away that actually does help somebody. So it's not going to hurt you. Theoretically, could help somebody else. So there's no reason to be concerned about it if you're vaccinated. Now, if you're sick with COVID, don't go give blood. I mean, I hope that goes without saying. But if you are vaccinated or you had COVID a while ago, at least 10 days ago, probably closer to 90 days ago, then it's fine to go give blood.
Dr. Conard, what would you say to someone that's maybe on the fence about donating?
What really hit me hard is I've been thinking about this, and we've been encouraging everybody, our patients, our friends, coworkers, to go give blood. Every 2 seconds, someone in the United States needs blood or platelets. That's 36,000 units of blood cells a day and 7,000 units of platelets. So it's critical, and only 38%, only about 1 in 3 can actually give blood in the United States. So if you can give blood, you are special, you're needed, and please don't hesitate to go take 15 minutes and save somebody's life.
I've got one more question for you, Dr. Conard. If someone can't donate blood, is there any other ways that they can possibly help then?
Well, I would have to ask you to call the American Red Cross. I know they have a lot of need right now for people to volunteer and to support what they're doing. American Red Cross does approximately 40% of all blood transfusions comes from them. So I am sure there are many, many things that we can do to support the drive to get blood, people coming in to get blood, and then any communication, education that people need to encourage them and support them in being a donor.
We appreciate your insight tonight, Dr. Scott Conard. Thank you so much for your time.
Thank you.
All righty.